time and pertinent. Dear honorable guests and delegates, the conference will take place for 4 days, focusing on its prime objective as stated earlier. Nevertheless, clinical officers and physician associates were playing a significant role in attaining universal health coverage in their respective countries. Their potential shall be enhanced. And one way to achieve this is by harmonizing the skill mix among non-physician practitioners across the globe. I'm confident that these issues will be fully addressed by formidable speakers, either locally or internationally, who will be sharing their expert thoughts and vast experience with audience during this 4 days conference. Dear colleagues, we all are gathered here with the same goal in mind: to impart our expertise, experiences, and enthusiasm in attaining universal health coverage. So let's seize this chance and make the most of every second, and I do not doubt that the coming days will be full of insightful conversations, fresh connections, and a lot of motivations. I appreciate your presence and I wish you a nice and fruitful experience. Last but not least, I want to express my gratitude to the organizing committee for all their effort and commitment over the past months. Your dedication has been crucial in enabling GACOPA to accomplish its mission and ensure the conference goes well. My sincere thanks to the Central Committee of GACOPA for their confidence in assistant medical officers in Malaysia to host the 3rd International GACOPA Conference. I would like to take this opportunity to thank Yang Berhormat Dr. Zaliha binti Mustafa, Minister of Health, and the Ministry Health's top management for their assistance in making this conference a success. To all comrades, join us in making this conference a remarkable one. With that, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Guru, for the opening remarks. We will now welcome Mr. Austin Odo Otino, President, Global Association of Clinical Officers and Physician Associates, GACOPA, to deliver his speech. Please welcome.
To the Honorable Minister for Health, Malaysia, Dr. Zaliha Mustafa, our honored guest, the Director General of Health, Malaysia, Datuk Dr. Mohamed Radzi Abu Hassan, the Deputy Secretary of Health, Malaysia, Dato Zainal Al-Hakab Seman, the Deputy Director General of Health, Dato Dr. Azmayani Kalib, Dr. Mohamed Azman Yacob, Director of Medical Development, Professor Dr. Ismail Mohod Saibon, Patron, Malaysia Association of Medical Assistants, Mr. Zulhemi Abdullah, Chief Assistant Medical Officer, Malaysia, Mr. Haji Mustafa Majid, the President of the Malaysia Association of Medical Assistants, the Director of Clinical Services, Kenya, Manasseh Bocha, Professor Mary Shotrak, the Global Ambassador of the Giant American Academy of Physician Associates, Lumbani Shotetsi, the President-elect of the International Academy of Physician Assistant Educators, several honorable members present, led by Honorable Ruth Labode from Zimbabwe and Edward Zero, both chairs of the respective health committees, key government officials from different countries, led by Tom Ishira, the Chief Officer of Health, and Mary Susan, both Chief Officers of Health from different regions, union officials present here, led by Peterson Washira and Mary Boniface, both chairs from Kenya Union of Clinical Officers, chairs of boards and regulatory bodies and stroke councils, led by Professor Simon Kangete of Kenya and Professor Manamuntu of Zambia, registrars from the councils, led by Ibrahim Wako, Davis Olowere, Ibrahim Wako from Kenya and Davis Olowere from Malawi, respective association presidents present here, led by Dr. Serkelem Girma, the president of the Ethiopia Health Officers Association, Neba Jones, the Zambia Clinical Officers Association president, and also the president of the GACOPA East Africa, the PA Society of Germany, representative led by Jan Olaf, the GACOPA director, organizing director Chris Onditi, and the GACOPA deputy director of communication Solomon Chomba. Dear colleagues and friends, ladies and gentlemen, thank you for your presence and enduring support to the Global Association of Clinical Officers and Physician Associates. It means a lot to the clinical officers, the PS, the medical assistants we represented, and at this particular ceremony, it means a lot to me. Those of you familiar with GACOPA know that our journey, which started 13 years ago, has culminated to several successes despite the little resources at hand. We are spread in almost 40 countries in the world as we set our eyes on a realization of a common name. I welcome you all with profound joy and humility to the 3rd International Delegates Conference here at the beautiful Everly Hotel in Putrajaya. Malaysia is amazing. Medical assistants have pledged to dedicate their lives to the service of humanity and have the health and well-being of their patients as their first consideration. We as medical assistants practice our commitment to these principles, not just when attending to our patients, but also when we join our associations in their multiple activities, aiming at the end to raise the health status and quality life of the population. The theme of this year's conference, Harmonizing Clinical Officers and Physician Associates towards attaining universal health coverage, in recognition of the role of this personnel in ensuring universal accessibility of quality and affordable healthcare to all. 3 things that we really need to look at: common law, common curriculum, and common nomenclature. As we really push to have this harmonization, we are partnering with like-minded associations like the EAPI, AMTC, together with respective national associations, unions, to ensure we achieve our main objective, harmonization. After 2 successful sessions of the GACOPA conferences in Ghana 2018 and Rwanda 2020, we are proud to present this 3rd edition here in Malaysia. This was a culmination of a long and exquisite planning against the backdrop of the COVID-19 pandemic and the restrictions that meant that the scheduled conference, which was to be held in Malaysia, will not take place as planned in 2021, and even the subsequent year, 2022. Nonetheless, we believe that GACOPA's annual scientific conferences like the one we're having today in Malaysia has excellent and exceptional opportunities which enables clinical officers, physician associates, medical assistants, etc., to become professionals in their clinical practices in which borders and distances no longer exist. This conference seeks to offer delegates the chance to debate pressing global issues, challenge practitioners to take on new perspectives, and build strong new partnerships that span across the globe. GACOPA prepares its delegates to become leaders in championing universal health coverage across the globe. This event will not only incorporate extensive discussion, but will also consist of additional workshops, guest speaker sessions, and scintillating social events that will help our delegates to develop networks and transform their ideas into action. Honorable Minister, according to WHO estimates, by the year 2030, the world will need about 18 to 20 million more health workers to attain UHC. Therefore, to achieve UHC and SDG, the critical issue of human resource for health, which affects every country, even though worse in lower, low, and middle income countries, needs to be addressed robustly. GACOPA shall advocate that countries take urgent steps to invest more in well-being, working and living conditions of medical assistants and other health professionals. This is to help reduce or eliminate physical and mental burnout of health workers and brain drain of medical professionals, especially from already underserved countries. To motivate medical assistants, Honorable Minister, GACOPA shall seek to establish a global, the GACOPA Global Health Excellence Award Scheme to reward excellence and the sense of duty, diligence, and uncommon commitment. And we were proposing that this GACOPA Global Health Excellence Award Scheme to be named after you, so that we move forward to award it every year. So that we every year will be awarding the excellent leader and the excellent practitioner under your name. It will be your award. We look forward to an intellectually stimulating and enjoyable conference, and we hope you do too. The host team for this conference, GACOPA Malaysia, has done its best to make this experience unparalleled and enriching for us. I cannot end this address without paying special tribute to Aziza Yusuf, our founding executive and deputy general secretary who lost her life last year. May her soul rest in peace. Thank you.
Thank you, Mr. Austin, for the speech. Ladies and gentlemen, we have come to the highlight of this wonderful event. That is the official opening ceremony of GACOPA 3rd International Delegates and Scientific Conference 2023 by Yang Berhormat Minister of Health Malaysia. For that, we welcome to the stage Yang Berhormat Dr. Zaliha Mustafa, Minister of Health Malaysia, to deliver a speech and also to officially officiate the opening of GACOPA 3rd International Delegates and Scientific Conference 2023. Please welcome.
Thank you very much, Mr. Chairman. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi washabbihi ajma'in. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan salam Malaysia Madani. The honored guest yang berbahagia, Datuk Dr. Muhammad Razi Hassan, Director General of Health Malaysia. Yang berbahagia, Datuk Zainal Kapsiman, Deputy Secretary of Health. Yang berbahagia, Datuk Dr. Asmayani Khalib, Deputy Director General of Health. Yang berbahagia, Professor Dr. Ismail Muhammad Saiban, Patron Malaysian Associations of Medical Assistants. Yang berusaha, Dr. Muhammad Azman Yaakob, Director of Medical Development. Yang berusaha, Mr. Zuhaili Abdullah, Chief Assistant Medical Officer of Malaysia. Yang berusaha, Mr. Haji Mustafa Majid, President Malaysian Associations of Medical Assistants. Mr. Austin Ortin, President Global Association of Clinical Officer and Physician Associates, GACOPA. Our distinguished guests, Directors and Head of Department, Ministry of Health, Senior Officers of Malaysian Qualification Agency, MQA, the Public Services Department, Malaysia, State Directors of Health, Hospital Directors and District Health Officers, CEO, Dean Directors of Academic Institutions, GACOPA Central Committees, ladies and gentlemen. Very long list, yeah? First and foremost, I would like to express my deepest appreciations and gratitude to the Global Associations of Clinical Officers and Physician Associations, GACOPA, the Assistant Medical Officers Service Sections of Ministry of Health Malaysia, the Malaysian Association of Medical Assistants, and the National Union of Assistant Medical Officers Peninsula Malaysia for inviting me to inaugurate this momentous conference. I would like to extend a warm welcome to Malaysia and international delegates to this third GACOPA International Delegates and Scientific Conference, which is being held for the first time in Malaysia. I'm very proud of this. Welcome to Malaysia. Your presence at this conference signifies your commitment and support towards health and the professional developments of clinical officers, physician associates, medical assistant, as well as any other similar professions. Given the current developments in global healthcare, the role of non-physician healthcare professionals has become increasingly crucial and demanding in ensuring the sustainability and resilience of health system. Hence, this conference holds significant importance as it initiates effort to harmonize all non-physician professionals in terms of roles and responsibilities. Training and educations and regulations and accreditation for clinical officers, physician associates, medical assistant, and related fields. Therefore, the theme of this conference, Harmonizing Clinical Officers and Physician Associates Towards Attaining Global Health Coverage, aligns with the spirit of the conference. Ladies and gentlemen, Malaysia takes great pride in having achieved universal health coverage since the 1990s. We have seen a substantial improvement across a range of health outcomes since independence. Infant mortality has fallen significantly from 75.5 deaths per 1,000 live births to just 6.1 by 2021. Maternal mortality has also shown a decline from 210 deaths per 100,000 live birth to 24.9 in 2020. This achievement testifies to our commitment to safeguarding the health and well-being of Malaysians. The sustained universal healthcare coverage, it is crucial that everyone plays their role in providing high-quality healthcare services to communities. The roles and responsibilities of non-physician professionals therefore become challenging and essentials in delivering preventive, promotive, curative, and rehabilitation healthcare. It is imperative that non-physician professionals continuously improve their knowledge and competence to serve the community effectively. In Malaysia, non-physician professionals are known as medical assistants or assistant medical officers. Now, we have heard the story just now. The profession is governed by the Medical Assistant Board under the purview of the Medical Assistant Act, which is Act 180, with a history of more than 200 years. Medical assistants have played a vital role in Malaysia's health system. Currently, over 24,000 assistant medical officers serve the public and private healthcare sectors, and as healthcare evolves, their roles and responsibilities are expanding into specialist areas such as cardiology, orthopedics, neurology, nephrology, emergency care, and many more. Assistant medical officers who undergo specialized training are registered as assistant medical officer, technical expert, IMOTEX. And the IMOTEX initiative recognizes assistant medical officers who have acquired expertise in specific fields, ensuring optimal delivery of healthcare. Currently, we have 385 AMO technical experts and are registered in phase 1, and I strongly believe that subsequent phases will see an increase, as our target is to register 50% of the AMs as technical expert by 2030. So we are looking forward to this. I'm delighted that the medical assistant profession has taken the initiative to establish the Academy of Medical Assistant, ACMA, and ACMA plays a significant role in enhancing professionalism and strengthening the profession through international collaborations. It is our hope that ACMA will evolve into a center of excellence for the professions in the future. Ladies and gentlemen, on the 15th of June, the Health White Paper was successfully tabled in Parliament and approved by the Dewan Rakyat. And this is the first time ever in history of Malaysia that we passed through the Health White Paper in Parliament. The comprehensive proposal outlines a 15-year plan to revamp Malaysia's healthcare system. It identifies key challenges and initiations and limitations while presenting inclusive and holistic reforms to address the healthcare needs of Malaysia. The health white paper is based on 4 pillars: improving healthcare delivery, the first one, promoting health and preventing disease, ensuring equitable and sustainable financing, and strengthening the governance of the healthcare systems. The Health White Paper serves as a crucial roadmap that will guide the future of human resource for Health Malaysia. By addressing the challenges and gaps in the healthcare workforce, it will pave the way for policies and initiatives to promote recruitment, training, and retention of healthcare professionals. Aligning the needs of the healthcare system with the effective human resource, planning and management will better equip Malaysia to meet the demands of a rapidly evolving healthcare landscape and provide high-quality healthcare services to all citizens. The Health White Paper represents a significant step forward in shaping the future of human resource for health in Malaysia and contributing to the overall improvement of the nation's healthcare system. Hence, it is my sincere hope that all stakeholders present today will collaborate with the Ministry of Health in implementing these much-needed reforms. Ladies and gentlemen, I have been informed that this conference will feature a wide range of activities and programs presented by experts in various fields. Plenary sessions, symposium, and concurrent sessions will provide an opportunity for expert speakers, scholars, and academicians from around the world, including representatives from international associations such as the American Associations of Physician Associates, APA, the International Associations of Physical Associate Education, and the Indian Association of Physician Associates to share their knowledge. I hope that the third GACOPA International Delegates and Scientific Conference will foster discussions, planning, and the formulations of the strategic to explore potential networking and collaboration among members of the profession. Ladies and gentlemen, finally, I would like to congratulate the Global Associations of Clinical Officers and Physicians Associates GACOPA, the Assistant Medical Officers Service Sections of the Ministry of Health Malaysia, the Malaysian Associations of Medical Assistants, the National Union of Assistant Medical Officers Peninsula Malaysia, and the organizing committee for making this conference meaningful and closer success. I hope that the exchange of ideas and global efforts will further enhance the professions and rewarded by Allah Subhanahu wa Ta'ala. To our international delegates, I encourage you to enjoy your diverse culture, fascinating natural attractions, and a variety of delicious food during your stay in Malaysia. With those final remarks and the lafaz Bismillahirrahmanirrahim, I hereby officially open the third GACOPA International Delegates and Scientific Conference 2022.
Thank you very much and really appreciate the speech. And Yang Berhormat Minister of Health Malaysia are requested to remain on the stage. Ladies and gentlemen, now I would like to invite all our honored guests to accompany Yang Berhormat Minister of Health Malaysia for the launching session as a symbolic of inauguration for GACOPA, the International Delegates and Scientific Conference 2023. Please welcome. Ladies and gentlemen, Yang Berhormat Dr. Zaliha Mustafa, Minister of Health Malaysia, will now strike the gong 5 times as a sign to commemorate the inauguration of GACOPA to the International Delegates and Scientific Conference 2023. Ladies and gentlemen, let's give a round of applause again. Without further ado, I would like to invite Yang Listener, Mr. Zohilmi Abdullah, Chief Assistant Medical Officer Malaysia, to present token of appreciation to Yang Berhormat Dr. Zalia Mustafa, Minister of Health Malaysia. Please welcome. Now, we will have an official photography session on the stage. All the media and photographers may ready in your position.
Thank you.
Yes. Oh, yeah. Welcome back to the GACOPA, the International Leaders and Scientific Conference 2023. With honor, we have been graced by the chance to gather in this momentous ceremony. Without further ado, I would like to invite Yang Berbahagia Dr. Muhammad Razi Abdul Hassan, Director General of Health, to deliver his keynote address. Please welcome.
Thank you very much, Mr. Chairman. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Salam sejahtera, salam Malaysia Madani. First and foremost, I would like, I'm actually in fact truly honored to be invited to share the keynote address for the Ministry of Health in Malaysia in conjunction with the GACOPA, which I'm very impressed in the sense that the participations from many, not just from Malaysia, but it's also I've seen just now walking through together with our Minister of Health, quite a number of the participants from the overseas delegate. So what I'll do is that I will try to perhaps share with you some of the directions in the Ministry of Health and how that we can get the medical assistant to be part of our journey, particularly in relations to what our minister has announced just now, i.e. the planning for the reformations of our healthcare system, which we all know the very fact that we need to change, we need to reform our healthcare because of all the challenges and also the issues that we have in the past. I mean, we have seen so much of the emerging problems, the pandemic, the COVID-19, which happened recently, and we have seen it's a test whereby we can see that our healthcare system almost collapsed because of the unpreparedness and also because of our healthcare system are not ready to face all those challenges. And what more now, I think we are facing with a lot more challenges, particularly with regards to what we call the non-communicable diseases, the quantum and the magnitude of the problem that we have right now, the aging populations, we're talking about the mental health problems and whatnot. So these are among the challenges which I feel that it's very important, every one of us, healthcare provider, including our medical assistant, to be part of this journey. So we have to engage everyone in that. So first and foremost, I would like to take the opportunity to convey my appreciation and thanks to the organizing committee again for inviting me to share the experience from Ministerial of Health in Malaysia and to deliver this keynote address at this esteemed international conference. Last but not least, I would also like to express my gratitude to the participants who have joined us today from Malaysia and international delegates. Your presence here signifies the importance and relevance of this conference. A warm welcome again to all of you and each and every one of you. Selamat datang ke Malaysia. Ladies and gentlemen, I have been informed that Global Associations of Clinical Officer and Physicians Associate, or GACOPA, series is now in the third iteration, following the successful conference held in Ghana in 2018 and Rwanda in 2020. It is a great honor that the GACOPA International Executive Council has chosen Malaysia as the host country for the third International Delegates and Scientific Conference. This year, the conference theme is harmonizing clinical officer and physician associate towards attaining universal health coverage. This theme highlights the objective of bringing together the non-physicians' professional roles in the healthcare field. The aim is to establish a unified structure that encompasses the diverse backgrounds of clinical officers, physician associates, medical assistants, and analogs in terms of the professional identity, roles and responsibility, training and educations, regulations and accreditations. I like this, the last sentence, the words that have been prepared for me to read the text now, because it illustrates to me that it's very significant in the sense that the healthcare provider need to be redefined correctly. I mean, very much focus so far is very much for the medical doctors or the physicians or the doctors itself. But I think we must look at the healthcare provider is a broader term. And I feel that medical assistant is one of the entity in the medical health provider which is really playing a big role, as big as, as equal or as important as also with the medical doctors or others equivalent to. Because I personally also, I'm just sharing with you, I'm very new in these positions as the Director General of the Health for Ministry of Health in Malaysia, and I've learned a lot. All my journey, or all my career as a medical doctor is all in the hospital. But now I'm start looking at the healthcare, and I start looking at the role of the healthcare provider. It should not be very much focused on the doctors alone, but we must broaden the role of the others as well, including the healthcare, including the medical assistants. I learned a lot during for the past almost 2 months now as a Director General, as a clinician before, and then I started to appreciate and also start to really value the other role of the group or category in the medical healthcare provider. Medical assistant, no doubt, they play a very important role. In fact, I've got the opportunity to learn a bit about the history of the medical assistants. Well, by about 20 or probably 30, 40 years ago, medical assistants has playing a very, very important role. I.e., there are jack of all trades, in fact, in a certain area. Whereby, if you look at in a certain, for example, like in Borneo, which is part of the important region in our country, Malaysia, medical assistant probably the backbone for running the service, the medical service in the interior area in Borneo. They are the ones who look after the patients in the community, at the hospitals. They assist the doctors in the community, or sometimes they themselves actually run the medical services in the community. In the hospital, to a certain extent, they are the first line in terms of the receiving the patients coming to the hospitals. They are also the ones who who look after, especially the simple cases, but not even just the simple cases, but to a certain extent, giving gas for the operations in the Borneo. So these are the roles which has been delivered or rendered by our medical assistant in Malaysia. So they play a crucial role, and they are the backbone in terms of providing the services, the medical services, all this while. So ladies and gentlemen, in addition, the conference also aims to promote knowledge as a crucial driver for effective policy planning and implementations in the pursuit of the universal health coverage. So the medical assistance also is a journey, it's an evolving journey. So you need to update yourself in terms of the medical knowledge. Delegates are encouraged to share and enhance their capacity in conducting clinical and education-related research by promoting evidence-based practice. This can be achieved by fostering a dialogue and exchange of ideas. So I think this is the whole idea of having this conference. It's a 4-day conference, which I sincerely hope that all of you can have an exchange idea, leverage the advantage that you have today, whereby medical assistance from all over the place, not just from Malaysia, but from other countries, even in Malaysia itself, from various parts of the countries, get together and try to learn from each other and also improve our knowledge in the medical fraternity. Ladies and gentlemen, lately the world has faced significant challenges in dealing with the health-related problems, including COVID-19, both communicable and non-communicable diseases, nutrition and poverty, climate change, and others. Malaysia is no exception. Our healthcare delivery system needs to be ready to address these challenges. For your information, Malaysia is gradually transforming an aging society and is projected to become an aging country by 2030. Consequently, medical costs and healthcare expenses for individuals aged 60 and above are anticipated to be 2 or 3 times higher compared to the adult care costs. So again, I would like to highlight again what I've said earlier, i.e. that the demand for the healthcare is going to be very, very challenging. It's going to be a lot more. It's probably going to be different from what we are seeing for the past many years. What's coming is going to be more challenging, ladies and gentlemen. I mean, take for example in here, whereby we're talking about the aging populations. So if you're talking about aging populations and then with the advancements of the medical technology and also the medical health, people are living longer. But it's good if you are remain productive and active. But what we are seeing right now, the older you are, the more medical problems you're going to have. So the more challenging for our healthcare system to provide, to meet the demands of all this increasing burden of the aging population. We have seen a lot, I'm sure in my family itself, I've seen the elderly becoming more dependent, their mind is giving away, they're getting demented, it's going to has a huge problem to the society and also to our healthcare burden, as well as the medical problems. As they grow older, the NCDs is becoming more common among the elderly. So these are all the challenges that we have to face and to get ready. And there's no other way. We have to reform our healthcare, because if the way that we have been doing has been proven, it's going to fail or it's going to break, it's going to have a breaking point to a certain extent. So we have to change. We must get ready to change, to reform our healthcare system. The rising prevalence of non-communicable diseases, including mental health issues, and communicable diseases such as COVID-19, polio, measles, has also posed a burden on the public healthcare system. Therefore, the healthcare system clearly needs to be reformed to overcome the increasingly complicated challenges. This prompts the 12th Malaysia Plan to outline. The 12th Malaysia Plan is a span from 2012 to 2025, which is not very far to go. Next year is the span ends the 12th Malaysia Plan to outline the healthcare reform action plan known as the Health What Paper. This plan is now being actively introduced to all individuals and has been recently passed in the Parliament. This was mentioned by YB Minister just now during her opening address. The reform strategy is based on 4 crucial pillars that we all need to internalize, i.e. the number 1. I think this is very important because I feel that our healthcare white paper is very comprehensive that I would like to share to all of you. Probably something not new to those who are from Malaysia, but this is what I would like to share again, the importance that we have to realize our health white paper through the 4 pillars. And the first pillar is transforming our healthcare delivery. This is very important because we all see now, I mean, the problems that we have. Because when we talk about healthcare reform, the main thing that we would like to do is to increase the access, to realize what we call this the medical health equity, i.e. that the healthcare should be for everyone. No one should be left behind. So it's not only for those who have a deep pocket, those who have the money in order to buy or to afford their healthcare, but it's also a fundamental right to everyone, including those who cannot afford, those to the vulnerable groups, so on and so forth. They should have an equal chance or equal opportunity to access to the healthcare. So the first thing that we would like to do will be that to transform our healthcare delivery. So we have seen now that our appointment, how to get to see the doctors or the specialists, is getting longer and longer. The elective procedures, the operations, is getting longer and longer. And we are facing, for example, like the urgent cases, for example, like those people who are waiting for the coronary artery bypass surgery, for example, have to wait for about 6 months to a year. So this is not something which supposed to happen during this century, whereby we have all the technology, we have all the advancements, we have all the knowledge in the medical. So this should not be happening. So we need to do something about it. We need to improve, especially how best that we can improve the access, the distributions of the healthcare facilities, particularly. It should be cut across the country, regardless whether they are in a remote area or whether regardless of the type of the population, so on and so forth. So I think this is something that we need to do aggressively to increase the access, and by increasing what we call this transforming the healthcare delivery, so that we can make some changes to. Malaysia is very fortunate because we have probably one of the best in terms of the infrastructure. We are good. I mean, I would not consider that we are the best, but we are good in that sense, in terms of the infrastructure. So what we need to do now is that to transform and try to get everyone to put their brain and mind how best that using the existing facilities, the one that we have right now, in order to improve and also in order to strengthen our healthcare delivery. So this is something which I believe in the next 15 years, because health white paper is spent for the next 15 years. So we hope so within that 10 to 15 years, we should be able to improve the first pillar, which is very important, is to increase or to strengthen or to transform our healthcare deliveries, both in the public as well as in the private. The second pillars which we are trying to do right now is to shift the mindset. We are very much, I think we have been so much focusing on the sick care at the moment. And in other words, it's also very much into the hospitals, the specialties, and so on and so forth. We spend so much, but we probably, because of all these advancements, and also because of the evolving in terms of the pattern of the disease. But what happened was that our focus is so much into what we call this, the sick care, but we have forgotten what's the root of the problems which have been happening all this while. For example, number one, we're talking about the healthcare diseases, the non-communicable diseases. The best example which I can give to you, the diabetes. You see, We have been spending so much time, so much money, so much effort, so on and so forth, finding the ways on how to treat diabetes. But look at what happened until now. Have we? We have not, indeed, in terms of the managing the diabetes. If you do the audits of our diabetic patients, majority, I would say, I will not be wrong, at least 80% not within achievable target. So what are we doing? So I think the best way is actually to look at again what is the root of the problems, what we can do rather than what we can't do. Okay, I think 20-30 years has already proven us right. I mean, this is not going to end anyway. The number of patients going to get admitted is going to increase. The number of the procedure, the number of the medicines, expensive medications is going to be increased. You will not be able to cope. So now the shift should be more towards the prevention, i.e. whereby that we must look at how best that we must try to intervene early to prevent from the disease to occur. Through whatever the intervention that we can think of. There are actually most of the diseases, including the cancer, they are preventable. So we're going to shift this mindset from the sick care now to the health prevention, health promotions, and also health well-being. Rather than we're going to start to looking at to maintain those people who are healthy, to remain healthy for the next 50 years or until the end of their life, so that they have the quality of life. So from what we call our mindset now, not that we're going to follow the sick care, we still have to continue on to help or to try to improve the sick, but most now the focus to shift to the certain extent or even to the greater extent to the health prevention. So this is a pillar 2 in our health white paper. And number 3, we're talking about how that we can look at, because at the end of the day, in order to improve the healthcare system, so on and so forth, we need the money, we need the funding, and we need the budget. So we have seen and we have learned that our healthcare system is not sustainable financially at the moment. Because government of Malaysia is one of the few countries in the world, I was proudly say here, is that it's one of the countries whereby you get free, almost 100% free, what we call this healthcare benefits. You just imagine a dollar ringgit Malaysia, which is one. I think it was about 30 cents, I think, perhaps about 30 cents or 40 cents US currency. You are able to get almost everything about the healthcare. You can get your clinical outpatients, you can get all the investigation done, you can get the x-ray, if you get admitted, you can get everything's free, almost operations, whatnot, even the high-end subspecialty, the procedures, they're all almost free, except in a certain category. And even that, the charge is very minimal. And we realize now that it's not sustainable. We will not be able to continually subsidizing all these finances. So we need to revamp our healthcare financing as well. We have to come up. We have come a long way actually for this healthcare financing. We have tackled, we have debated, we have deliberated so much. But now it's time for us to seriously looking at how best that we can revamp, or we can look again at our healthcare financing. And the last, which is also equally important, all the other 3 pillars will be that we need to revise and restructure our healthcare. I mean, we have to look at again some of the what we call the structures, some of the acts, or some of those, because you just imagine in any institutions or in any governments, or we will have what we call this the acts and also the guidelines and so on and so forth. And some of it has been for many years. So it's time for us to review and relook at all our this restructuring looking again, relook and look at every aspect of the governance in our healthcare white paper. So this is one of the things we would like to do. So again, there are 4. This is probably, I know I'm probably almost 11 now. So I would like to reiterate how can we do the reform of our healthcare using 4 pillars, which the bottom line is to get the access. Number 1, we're going to reform our care delivery system. Together with some changes in order to improve the access and the medical equity or the health equity. Number 2, we are talking about to shift the mindset from the sick care now to more for the what we call this the community, the prevention. So this is where the Medicare assistant now also I would like to be with us, especially with these two pillars. Your roles are very, very important in realizing these 2 pillars here. The third one, which is the healthcare financing, I think that's the what we call the relevant parties will look into that, and the governance is sort of the same thing as well. So with that, I think because I'm running out of time now, I'm going to conclude now. Ladies and gentlemen, Malaysia has achieved significant progress in meeting the aim of universal health coverage. In fact, our health white paper is very much in line with what is the universal health coverage. Universal health coverage is, the bottom line is again, is talking about the access and also improving the health equity. One of the initiatives that I will not go into the enhanced primary care here, which I think maybe if the outside the foreign delegate can interact with our local delegates about how we can incorporate our medical assistant into the so-called enhanced primary healthcare system. Okay. In a global context, I'm content that through active dialogues and collaboration, we can achieve our collective aspiration to achieve universal healthcare and enhance global healthcare system. So finally, I hope the conference can, as it is planned, serve as a platform for networking, knowledge sharing, and generating resilient solutions to tackle global health challenges. I encourage all participants to wholeheartedly embrace the opportunity and actively engage in all sessions and events that will take place. So with that, thank you very much for all your attention.
Thank you very much. Yang berbahagia Datuk Dr. Muhammad Razia Wasan for the speech. Yang berbahagia Datuk, I request to remain on stage. Without delay, I would like to invite Yang Besar Mr. Zulhindi Abdullah, Chief Assistant Medical Officer Malaysia, to present token of appreciation to Yang berbahagia Datuk Dr. Muhammad Razia Wasan, Director General of Health Malaysia. Please welcome. Thank you very much to our volunteers, and you are invited to take your seat.
Oh.
Ladies and gentlemen, we will continue our session today as our first plenary session of the conference today, entitled Accelerating Universal Health Coverage, Role of GACOPA in Exploring Policy Options in Expanding Universal Health Coverage in the 21st Century. With the President of GACOPA, Mr. Austin Odo-Otino. I would like to invite Ms. Siti Muhammad Rahim binti Muhammad Yusuf, Assistant Medical Officer from Hospital Sukabumi, to share this session. The floor is yours.
Okay. Thank you to our MC for the kind introduction. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to all guests and delegates. I would like to welcome all of you to our GACOPA, Third International Delegates and Scientific Conference 2023. Our first speaker is Mr. Austin Odua, OTNO, who will be talking about accelerating universal health coverage, role of GACOPA in exploring policy options in expanding UHC in the 21st century. Since Mr. Austin is the leading expert in this field, I am sure that his presentation will be a thought-provoking. Before we invite our speaker, I would like to remind everyone to please turn off or mute your cell phones. We will also be having a Q&A at the end of this session, so please raise your hand if you have any question. Ladies and gentlemen, to prevent any further delay, I will now introduce you our distinguished speaker, Mr. Austin Odua, OTNO is a He is also the National Deputy Secretary of the Kenya Union of Clinical Officers and among the founding members of the union in Kenya. Austin has experience in sensitizing this cadre by bringing together more than 15 countries together through visits and using the GACOPA to create this awareness. He is also pursuing the dermatology specialty at the Muhimbili University of Health and Allied Sciences in Tanzania. Mr. Austin, the floor is yours. You may use this. So this is the mic.
The topic is accelerating universal health coverage, role of GACOPA in exploring policy options in expanding UHC in the 21st century. Actually, my slides are very few and they'll be on point. It will be very easy to understand them. I want to another symbiotic presentation by Peterson Washira, which was embedded with this presentation before a short video, because I've been given 40 minutes in this session. So I'm Austin Odua, I'm the president of GACOPA. I'll take you through this this topic, accelerating universal health coverage, role of GACOPA in exploring policy options. Okay. So, Global Association of Clinical Officers and Physician Associates, GACOPA is a global organization. Just a short history about GACOPA. It includes clinical officers, clinical associates, physician assistants, assistant medical officers, health extension officers, sub-assistant community health medical officers. There are several names. There are close to 20 titles, but they all we are all one. That is why we are fighting to have a common name. So all these names we've not mentioned all of them. That's why we put analogs there. And even most countries have got different names. Like here in Malaysia, we have assistant medical officers. We have medical assistants. If you go to Malawi, we also have medical assistants, clinical officers. You go to Germany, you have the PS, USA, the PS, doctor assistants in Botswana, clinical associates in South Africa, Zambia, Uganda, Kenya, South Sudan, Malawi. They take up clinical officers, that name clinical officers. And Papua New Guinea, the health extension officers, Papua New Guinea. So our headquarters is in Ghana, Accra, Ghana. And yesterday, if you people, those who happen to have attended the first session in day one, you were told about the history of GACOPA. I don't want to repeat it. GACOPA was formed in 2018 and registered, and we held our first conference in 2019, then 2020, and this is our third conference. So the association has grown to cover over 28 countries spread across the world. We've had two successful GACOPA conferences in Ghana, and Rwanda 2018-2020. This one written to Tanzania Zanzibar 2023 was a regional conference for the GACOPA East Africa chapter. So due to COVID, the scheduled Malaysia conference could not take place as planned in 2021 and as well as 2022. GACOPA brings together global interest of clinical officers, physician assistant, doctor assistant, clinical associates, medical assistants, private organizations, WHO, ILO, and governments to improve healthcare and welfare of the people of the world. In essence, enhancing universal health coverage. So the association gives health professionals and stakeholders a platform to share, consult, and negotiate power. This is the theme that all of us know, harmonizing clinical officers and physician associates towards attaining universal health coverage. So under the accelerating universal health coverage, these are the key points that I noted. The process of expediting and expanding access to essential health services for all in individuals and communities without facing financial hardship. And UHC is a goal outlined by WHO, then complex and long-term process that requires sustained commitment, adequate resources, and multi-sectoral collaboration. So these are the strategies to achieve universal health coverage that we are trying to employ. And in the first one is political commitment, where we'll do resource mobilization, policy formulation, and implementation. So here, at the end of this my presentation, there was one of the key personalities who was to attend this conference. So we decided to do a short video presentation, and the political commitment, that is where we rely on, and you can see that the minister attended this conference that we had. So it's a very key strategy, key commitment, key part that we really want to use as we seek to achieve universal health coverage. Then strengthen robust health system, improving infrastructure, training healthcare workers, ensuring the availability of essential medicines and technologies, and strengthening health information system. Expanding service coverage, comprehensive package of essential health services responsive to citizens' needs, preventive, promotive, curative, and rehabilitative services. So another strategy is addressing social determinants of health, social, economic, and environmental. So another one is also community engagement, harnessing innovation and technologies advancements like telemedicine, mobile health, multi-sectoral collaboration, and effective monitoring and evaluation system. So the role of the GACOPA in policy formulation, I also summarized that. Expertise in healthcare delivery, identifying healthcare priorities, evidence-based policy recommendations, advocacy for patient-centered policies, collaboration with policymakers, implementation support, bridging the gap between policymakers and healthcare providers. All this are what we are really doing as GACOPA, and I don't want to take much time going into the nitty-gritties. So this is my summary. GACOPA members and clinical officers affiliates contribute significantly to policy formulation, collaboration with policymakers and multi-stakeholders, other healthcare professionals, researchers, and community representatives is crucial in ensuring diverse perspectives and expertise are considered in the formation and implementation of UHC policies. So, before the video, can you just stop the video first? So there is a very important person who was supposed to attend this conference. He couldn't make it because he had an urgent engagement in the Philippines. So this key person is someone who is known in the world, and He's visited more than almost, he told me that only 5 countries in the world that he has never visited. And he's been very passionate about developments that take place in the entire world. So this person is a professor of law and is the founding member of the PLO Lumumba Foundation and a consultant with Lumumba and Lumumba Advocates. He is a member of the Africa Justice Group. He has authored several books on diverse subjects. He was the 5th Apollo Milton Obote Memorial Lecturer in Kampala, Uganda in 2017, the 2nd Ray Piri Memorial Lecturer at the University of Mpumalanga in South Africa, and the inaugural of Samora Moises Machel Memorial in Maputo, Mozambique in 2021. With several thousand speeches on diverse subjects delivered in and outside Kenya, Lumumba is recognized as one of the leading public speakers in Kenya and across the African diaspora. Professor Lumumba is also the founder of several organizations, including the PLO Lumumba Foundation, a charitable organization that has been in operation since 1990. The Association of the Citizens Against Corruption and the Movement for Dialogue and Nonviolence Modern. He has also been twice recognized as one of the 100 most influential Africans. So this man who has got a very, very long CV, I had to summarize it because it was around 5 pages, is one of the person who was to be one of our second key guests, but he could not make it. So I want to introduce him, and the media team should show us what he really wanted to tell us in summary.
At the very outset, permit me to thank and at once congratulate the organizers of the meeting that has brought together medical assistants from all over the world here in Kuala Lumpur in Malaysia. I would have loved to be with you physically, but courtesy of technology, I will join you in this manner owing to other engagements which stood in my way to travel to Kuala Lumpur. Let me say how glad I am that you are congregated for the purpose of examining the work that medical assistants do. Many see doctors as the prime movers, and one cannot in any event deny that doctors are significant in the wheels of the medical world. But the heavy lifters who are sometimes ignored are the medical assistants. And A meeting such as this is not only important because it allows you to cross-fertilize and cross-pollinate your ideas, but it also allows you to determine the ways and means in which you can sharpen your tools in order to ensure that health services are delivered in an effective manner throughout the world. Your role is particularly important in countries where money does not allow access to doctors, and yet the need for medical services is ever great. I congratulate you, as I said at the beginning, and do hope that you will use this occasion to ensure that the network that you are creating now is used to good effect for the benefit of all humanity. I thank you and wish you the very best.
In his office, is very rare to find. We told him if he knows about clinical officers. And he said, oh, clinical officers, they are the ones who are also called medical assistants. Then we told him that, yes, we find them in very many countries in Africa and even in Asia. Then I asked him, which part of Asia? Malaysia. Malaysia have medical assistant, and this is not even a medical practitioner. So he reads a lot of books, and he really knows everything pertaining our profession. That is why we have to bring him on board. And you know, he's followed by more than 5 million people. So by acknowledging us here, just know that 5 million people are already following us and they know who clinical officers are. So before I take up my seat, there was another presentation, a short one, by Peterson Washira that will augment this presentation that I have because we did the presentation together. So he's my co-presenter and he has a very, very exciting presentation before I take up my seat. So welcome, Washira. He's also the chairman of the Kenya Union of Clinical Officers.
Thank you, Mr. President. All the presidents of the associations, different associations with us here today, all the chairmen of the regulatory councils, all the CEOs, the registrars, and esteemed guests. It's my pleasure to share this podium with President GACOPA, and thanks to the President for giving me this opportunity to be able to take you through just a conversation. Actually, what I'm doing here is just to spur a conversation about what PLO Lumumba has said, about how do we concretize whatever we are talking about so that we can see our coming together, giving us the results that we actually do desire. So I have a very few slides, and I'll just be talking about how do we then open up for our equivalents so that an AMO from Malaysia can actually come to Kenya and can be equated and be able to practice. How can a Kenyan clinical officer come to Malaysia and can be equated and be able to practice? So next slide. So about working in different countries and in different continents, when it comes to Africa and especially East Africa, it is fairly easy to transition from one country into the other. And basically in African countries, even where you cannot be easily transitioned, you then go through a few of the procedures and you can actually be transitioned and work, practice your scope. But when it comes to intercontinental transition, then it becomes a problem. And why the problem? Next slide. Next slide, please. So the difficulties that we actually do have, one is because of regulation. Do we have a common framework that can actually determine equivalence? And I think one of us in the presentation will actually be talking about that. What about the level of qualification? You find that in some countries, like Kenya, for example, like especially East Africa, the lowest qualification is at a diploma level. And I also believe also for AMOs. But when you go to physician assistants and associates, it's at the master's level. And so the question now arises, because the qualification level and the scope of practice, they're different. While in East Africa and Africa in general, they qualify at the basic, at diploma level. Because, some of them, actually majority now have a degree program. Then you find actually their skill set, their scope is a bit higher than those qualifying at a master's level. And so how do you equate them? Do you equate the academic qualification? Do you equate the skill set, the scope of practice? And of course, talking about the numbers of years taken, it's different for those qualifying at diploma and those qualifying at the master's level, and the different curriculums, of course, conferring different skill sets to the equivalents. Next. So what would be the enablers to us transitioning into international markets? And one of it could be common law, common curriculum, or a common nomenclature. And we proceed to the next slide as we explain them. So what is this commonality in law? I'm basically talking about regulation. So you're looking at definition, and definition in terms of title. And I'm happy that my brother Scott will be talking about how can we have a common title so that we are singled out from the International Labour Organization classification of professions, where currently we actually classified as paramedics. And why are we classified as paramedics? Because we have not come together as the equivalents so that we can define ourselves forward one title so that we can be singled out and we stand alone as a profession. Then what about regulation? About peer regulation, we still do have countries where the people who actually regulate us are not ourselves, where we are regulated by medical doctors and others. And then practice. That is commonality in terms of scope of practice, our skill sets. Can we be able to harmonize our curriculum so that at different levels of qualification, an ongoing conversation, I think from the initial meeting of the GACOPA, this has been a constant conversation. So what are we proposing in the next slide? My proposal would be that under this GACOPA, we actually do have 3 committees, Mr. President. If members will find it to be wise, that we have a committee on common law or regulation to basically harmonize in terms of peer regulation, in terms of defining equivalence, common curriculum to confer comparable level of skill set, and another one on common title. And if we achieve this, ladies and gentlemen, then I believe that we will have achieved our goal of being able to actually equate across the globe and be able to transition into the international markets. Thank you. That is my presentation. I will start by saying Tarima.
Thank you to Mr. Austin and Mr. President for the interesting sharing and thought-provoking presentations. So we will now open the floor for questions. Please raise your hand if you have any questions to the speakers. Okay, so if there is no question, so we will now conclude our plenary, first plenary. So I would like to invite Mr. Mansur Pana for the token appreciation.
Mimi si unajua hata sini hizo ma regulation, hiyo topic nilichagua tu.
Certificate. On behalf of everyone here, I would like to thank again Mr. Austin and Mr. Patterson. So we have honored to have you today. So with that, I conclude our session and I pass back to our MC. Thank you.
Let's give once again a round of applause to Miss City Director Ayin binti Muhammad Yusuf and our speakers. Now, I would like to invite Mr. Zanik to make some announcement regarding activities of Exhibition Hall. Please welcome.
To all delegates, just to highlight to you all that we are having a 14 booth just near the hall. Okay, so I would like to invite you everybody. Okay, I prepare a special form here. Okay, what you need to do is to
Welcome to launching ceremony first announcement to official website GACOPA Malaysia.
In conjunction with the launching of GACOPA Malaysia, the website, official website for 3rd International Delegates and Scientific Conference of GACOPA. First and foremost, I take this opportunity to thank Mr. Mansur Pana and his devoted team for their hard work to build the website for this conference. I have been made to understand the multimedia team has been working for over 3 weeks on making this website a success, and henceforth is launching today. For all those present, this website is a homemade website. We have utilized all their abilities.
I would like to welcome everyone to come to this Malaysia GACOPA 3rd International Delegate and Scientific Conference 2023. So our plenary speakers, Dr. Muhammad Azman bin Yaakob,
who will be talking about universal health coverage, the Malaysian experience. He's a leading expert in this field, and I'm sure his presentation will be interesting to attract us enough. And before we begin, I would like to remind everyone to please turn off or mute your cell phone. We will also be using a Q&A system, so please raise your hand if you have a question at the end of the presentation. Now, before we start, before I invite the speaker, let me introduce our speaker to all of us. Dr. Muhammad Azman bin Yaakob is a Jusa C holding position as Director of Medical Development, Division of Ministry of Health, Malaysia. He is graduated from MS Ramaya Medical College, Bangalore University, bachelor degree in medicine and bachelor degree in surgery at 1999, and started to serve under Ministry of Health, Malaysia since then. He also holding Master in Community Medicine, graduated from University Science Malaysia. He is holding various high positions starting year of 2009 as Deputy Director of Medical Practice Division since then until now. He is also contributing a lot either locally in conference, developing standard operating procedure and guidelines. In terms of international contribution, he also contributed in a lot of scientific papers, and he has also published book under Lambert Academy Publishing entitled With Stress, Associated Factor and Salivary Biomarker among Assistant Medical Officer in Ministry of Health, Malaysia. He received various awards locally and internationally as well. So with this, I'm honored to invite Dr. Muhammad Azman bin Yaakob to share with us regarding universal health coverage.
Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Subhanaka la 'ilma lana illa ma 'allamtana innaka antal halimul hakim. Thank you, Mr. Moderator. Distinguished guests, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh, and very good morning and salam sejahtera. First of all, I would like to thank the committee, especially the GACOPA, for inviting me to be here today to give some thought on the universal health coverage, the Malaysians' experience. To me, it is very honored to be here again, to be with all of you here from Malaysia as well as those from overseas. I can see some familiar faces as well. My colleagues from previous place which I work with, from Kelantan especially, and those still here and breathing in Putrajaya, not missing anywhere. I would like to congratulate to the Mr. President of GACOPA, Mr. Austin Otieno, to be here with us and then give some thoughts on the universal health coverage as well. This is my first slide. Don't worry, I have only I think 16 slides. It may take me about 20 minutes to finish everything. I hope I can cover each and every corner of universal health coverage experience in Malaysia. Okay, this is my second slide. Ladies and gentlemen, as we all know that each individual faces risks for unexpected loss of health at any stage of our life cycles. Yeah. From womb to tomb, be it the children, adulthood or old age stage. So can be a geriatric patients as well one day. All of us here, I do believe some of us here is already fall under old age category. Do you agree with me or not? We are all a geriatric, not me yet, some of us here. So for Malaysia, by 2023, we are in the aging populations. It is about 7 years from now. To all my Malaysian clique, are we ready for this? What about the international participants here? Are your country ready to accept the aging populations in your states? This is something that we have to think of. Yeah, because of our healthcare system, because we are in a good health. One day, all of us, inshallah, will attain that populations to be an aging one. So hopefully that during that age, we are well, no heart issue, but which is very, very tough to ensure that we have no comorbidity or any NCD in the future, unless we are take it seriously from now to prevent NCD happenings in our life. The risk subsequently will cause, number one, the catastrophic health spending, where individuals have to choose between spending on healthcare needs versus buying other necessary items, for example, food, housing, or education. This will subsequently increase the household expenditure on health services and goods. The second part is loss of current and future ability to earn income. Of course, as we are getting old and fall under the geriatric age, probably we are not able to earn any money. And if you are unlucky enough, you fall sick at the early age, we are unable to earn any income for our own life. So individuals also can lose their current and future ability to earn income following a severe health events in our life. For example here, those are suffering from diabetic mellitus, which was uncontrolled for several years. They may end up with renal failure. So this patient may need to go regular hemodialysis. Some are good enough. They still be able to earn some money, be able to go to work, to perform to some extent. But many of them actually suffer a lot. They are unable to perform any jobs to earn money for their life. So these people will seek for help from various government agencies as well as from NGOs. Okay, individual both risks will also cause significant economic vulnerabilities for individuals and their household. The family get affected, not only the person, the children in the family, the spouse will get affected when someone falls into a very serious condition of their health. Doesn't move. Okay, all right. Okay. Which one? I'm over there. Yeah. Doesn't work. First. Oh. Yeah. All right. What are the definition for universal health coverage? I think this is, I do believe all of us know about this. I do believe all of us aware about the definition of universal health coverage. UHC means that all individuals and communities receive the health services they need without suffering financial hardship. It includes the full spectrum of essential quality health services, from health promotions to preventions, treatment, rehabilitations, and palliative care across the life course. Meanwhile, we are also aware that for any healthcare system in the world, the aim is similar. The responsibility of any healthcare system is to ensure that the service provider able to ensure one individual can achieve the best of their health state, population as well as a whole can also be healthy. Not only the person, but the family, the community, and of course, the whole nation should be healthy. The health system need to warrant that the burdens of healthcare costs will not cause catastrophic spending to its populations. For example, if you don't have universal coverage in any country, what happens when a person needs a healthcare? The person probably need to get some amount of money. They have to sell their land, for example, to get the money for their healthcare. It happened in our country 20, 30 years ago. Men from urban area, from the rural area, need to sell their lands because of they need to care, they need to do bypass, for example. But nowadays, the government has spent a lot to subsidize all the healthcare for our nations. And finally, healthcare system should be robust enough to be able to meet people's expectations and demand. All these goals are aligned with the World Health Organization definitions of universal health coverage. We can see here the goal of can see a goal of health system. Number one, to have hygiene. It means both in the level of health and distribution of health, which is equitable and equal to all populations. Number two, social and financial risk protection. Distribution of burden of financing. As what our DG has mentioned in his speech, the third pillar of health white paper is to have health financial system for the country to make our healthcare system sustainable. The third one is responsiveness, which is ability to meet people's expectations. With the growing number of populations in the country, with the increased demand by our populations toward the health demands, we have to serve our people. We have to meet their expectations. How to meet their expectations if we don't have enough financial support? Either it is from the system or from the governments or from other means. We will fail to respond to their expectations. As you can see here, the Malaysia has systems improvement in health outcomes. For example here, we can see now Malaysians are living longer than before. When we compare to 1970s and 2020. This data is from Khazanah Research Institute, published in 2020. From the submission of as you can see here, the child mortality rate as well as the maternal mortality rate has improved in our country. If you compare in 1970s and 2020 or 2010, you can see the number of child mortality has been plateaued for so many years. We have done to the maximum, but the child mortality rate plateaued, as well as goes to the maternal mortality ratio in the country. What else we have to do? This is the platform that probably that we need to discuss further. What should we do then? We cannot blame those are coming from out of our country. For example, those are from Indonesia, those are from Myanmar, those are from Bangladesh, contribute to this. We cannot blame them. But what we have to do is we have to improve. We have to improve our health system to make sure that we can achieve better and better in terms of child mortality rate as well as the maternal mortality ratio for the country. Next slide, please. What are the challenges in providing universal health coverage in the country? Next slide, please. As you all know that Malaysia has dichotomous healthcare system, both by public and private healthcare providers. As you can see here from the table, even the numbers of private hospitals are bigger, which is 208. The data is in 2019. The number of private hospitals are bigger than the numbers of public hospitals, but the public hospital provided 72% of the total hospital bed in Malaysia, with of course the higher volume of patients compared to the private. Our healthcare cost is highly subsidized, with nearly 90% of costs covered by the government through annual budget. Even though Malaysia claims to have achieved UHC in 1980s, but the public healthcare system is chronically, I can say, need more fund, less than average of other developing countries. As you all know that Malaysia receives about 3.2% of our GDPs for our healthcare expenditure. This includes operational expenditure as well as the development expenditure. For this year, Ministry of Health received, especially the program Perubatan medical program, we received 12.4 billion